The doctors had never seen this in a little girl before.
Alyssa was having her period at 3 years old.
I knew my daughter was in trouble.
When I did force myself to eat an entire meal, I would projectile vomit. Nobody knew what was happening to my body.
Next, two medical mysteries that defied the experts. When Russ and Dawn Hazel find out their little girl is growing too fast, they're forced to face a terrifying reality.
I'm thinking, how does this happen? I wasn't ready to lose Alyssa.
I was petrified.
Then, when 19-year-old Samantha Mina hits 87 pounds, she begins to wonder how much longer she has to live.
My throat was closing, my chest was tightening. I was hitting rock bottom.
In January 1993, Russ and Dawn Hazel had just settled down in Ontario, Canada, and were focused on one thing: raising their 2-year-old daughter, Kristen.
Family life was wonderful. We spent lots of time together.
Dawn was a stay-at-home mom, and so she was at home with Kristen, and I went to work full-time. I am a police officer with the Town of LaSalle Municipal Police Service, so it was a little hectic at times.
Russ was the most involved father I have ever seen.
We had plans to have 2 kids, maybe 2-3 years apart.
That winter, the Hazels begin trying to conceive, and in February, they're delighted to find out that Dawn is expecting.
I got the phone call from Dawn. She told me that she was pregnant. We were ecstatic.
We couldn't be happier. I had a normal pregnancy. There was no complications. Everything was normal.
Dawn goes into labor on September 29, 1993. 5 hours later, the Hazels meet their new daughter, Alyssa Marie.
It's a miracle. You see this little bundle of joy come out. She had lots of red hair.
She was absolutely beautiful. She weighed 8 pounds, 10.5 ounces.
In fact, everything about the baby seems perfect, except for one unusual feature.
She had a birthmark, a very faint mark on her right arm. You can barely see it.
We didn't think too much of it.
Within 3 days, they're back home and quickly adapt to life as a family of 4.
Alyssa was a great baby, much like Kristen.
It was actually quite easy with the second child because Kristen kind of took to her, and Kristen was a great big sister, and she liked to play with Alyssa, and she kept Alyssa entertained a lot of the time. She was sleeping through the night probably within 6 to 8 months. She ate well, she was happy all the time, and we were having a great time with her.
Alyssa met all the milestone markers for a child her age.
Then, one sunny June morning, when Alyssa is 20 months old, Dawn makes a shocking discovery.
I went to change her diaper, and there was blood in the diaper. I was petrified. I didn't know what to make of it. I thought something had happened to her. I called Russ into the room.
I had no idea what was going on. Only thing I was thinking about is there's blood coming out of her. We're going to get her to the doctors.
We took her to the local emergency room. They just basically looked her over, and they looked at her private areas.
The doctors told Dawn and I she's bleeding vaginally. I was very shocked. I said, what do you mean she's bleeding vaginally? Like, how's that happen? Why is that happening?
And of course, they were concerned as to why a child that young was bleeding where she was bleeding. They were asking us if we had left her alone with anybody, or if, anybody we knew had touched her or done something inappropriate with her.
I got to a point where I said, I can assure you, I've done nothing to this little girl, and my wife has assured you she's done nothing to this little girl, and we got to find out what's going on here. After a while, they did believe me. And they said, we need to do some tests. We need to see inside her. We're going to need to do an ultrasound now.
A pelvic ultrasound is a test that they use to look inside your abdomen and see if there's any abnormalities. The ultrasound showed that Alyssa had a mass on her right ovary. On a child that size, her ovary should have been the size of a pea. The mass that was encasing her ovary was the size of a walnut.
The doctor said, she's bleeding, and it's associated to the ovary, and we don't know what this is.
The doctors thought that she had cancer.
If Alyssa has cancer, I thought that was a death sentence, and I wasn't ready for that. I wasn't ready to lose Alyssa.
They said that the best thing for Alyssa would be to go in and surgically remove the mass.
And they said, we're going to do the surgery, we're going to test it. If it is cancer, there's a good chance that your daughter may have to go through chemo and radiation and the whole 9 yards. We were just shocked, scared. I've never had surgery. Here's my baby, she's 20 months old, she has to have surgery?
We told Alyssa that she was going in to have the surgery. That was the hardest decision that Russ and I had to make, was to allow them to basically cut open our little girl.
The next morning, Alyssa is wheeled into the OR.
The door's open. She goes in, and Don and I are left there as the doors close.
I thought I might never see her again.
Minutes seemed like hours. It just seemed like an extraordinarily long time. Surgery was 2 to 3 hours. I didn't leave that door much at all. I'd pace. I just stayed there until the doctor came out. He told us that he got it all, but he could not salvage the ovary.
After the surgery, the doctor sent the ovary and the mass away to be biopsied.
And they said, we'll let you know the results in a month's time. So we went home with Alyssa. We were really upset that our baby could have cancer. The uncertainty played on our mind.
What if it was life-threatening?
Finally, an agonizing month later, the findings are in.
The mass wasn't malignant. It was a follicular cyst.
A follicular cyst is a large, fluid-filled sac in the ovary. Instead of releasing its egg, the sac keeps growing.
And he said, well, this is extremely unusual, extremely rare, Mr. Hazel. I can't tell you why it happened.
And they said that it would probably never happen again.
It was like a big weight taken off our shoulders.
We enjoyed ourselves. We watched Alyssa grow and heal.
Over the next year, Alyssa thrives, developing new skills every day. But then, one afternoon in the summer of 1996, the unimaginable happens.
We had taken Kristen for swimming lessons at the public pool. It was around lunchtime.
I had taken Alyssa into the bathroom, and we noticed that there was blood on the toilet paper, and there was like a smear of blood in her underwear. And I panicked.
My heart just sank.
I was terrified. I couldn't believe that it was happening again.
"12 months ago, 2-year-old Alyssa Hazel underwent surgery to remove an ovary and the cyst that was growing on it. And when doctors give her a clean bill of health, the Hazels are hopeful the worst is over. But now, a year later, Alyssa is bleeding again, and her parents are terrified that she'll lose her remaining ovary, or even worse, has cancer.
We took Alyssa to the emergency room and said, docs, here we are. Started telling them what had happened a year prior.
And they ordered specialized tests.
And the ultrasound revealed that there was another cyst on the left side.
The doctors just decided that they wanted to send us to a specialist to see if they could save the ovary.
The medical team immediately transfers Alyssa to London Health Sciences Center 2 hours away, where endocrinologist Dr. Mo Jenner takes over the case.
Alyssa was a frightened little girl, having been in hospital before and then coming into a strange hospital with strange people around. I did an external examination of the chest and the abdomen and the pelvis.
Dr. Jenner's examination reveals nothing out of the ordinary, but he's struck by Alyssa's height. She's much taller than most girls her age.
Dr. Jenner ordered a bone age to be done on Alyssa. They x-ray your left hand, and there's a chart that you can compare these bones with, and it will tell you pretty close to your exact age just by looking at the bones.
Her bone maturity was compatible more with a 5-year-old rather than a 3-year-old.
Playing a hunch, Dr. Jenner orders several blood tests, including one for estrogen.
Her estrogen levels, female hormone levels in the blood, were elevated.
My reaction when the doctor told us that Alyssa's problems could be hormonal was, what do you mean?
Dr. Jenner then told us that she probably had precocious puberty.
I said, you mean she's having, like, puberty, like a teenager? And he said, yeah, exactly.
Precocious puberty in girls is a condition in which excess estrogen causes the appearance of secondary sex characteristics and menstruation before the age of 8. Its causes vary and are often unknown.
Alyssa was having her period at 3 years old.
We were shocked.
As a result of her estrogen levels, Alyssa is also experiencing what amounts to an adolescent growth spurt, 10 years too soon.
The worst case scenario would be that Alyssa would grow very fast in her early years, so she would end up being extremely tall at a young age. Then her bones would come to a point where they think that they're at the age where they should stop growing, and her growth plates would fuse. And so she could be 4 feet tall, 5 feet tall at age 8 years old, and that would be as much as she grew.
Without any treatment, she would progress. With the secondary sex characteristics, which include breast development and pubic hair development, at the age of 3 or 4.
I'm thinking, how does this happen? There's no reason, no explanation. Where can we get some answers? And then how can we fix her?
To ward off early puberty, Dr. Jenner immediately starts Alyssa on a medication to keep her estrogen levels in check.
The hormone blocker should reduce the number of follicles on the ovary and cause some reduction in size so that the surgical option would not be necessary.
1 month later, Alyssa was scheduled for follow-up ultrasounds, and they showed that the cysts were diminishing. We were overjoyed that she was back to her normal self.
And by the time Halloween rolls around, the Hazels are beginning to feel confident that Alyssa's medical issues are under control.
That day, the kids were getting ready to carve their pumpkins.
Alyssa opened the door, and she just tripped and fell down. She had a little bump just on her, like on her shin, in the tibia area.
We figured she'll be fine. But over the next week, the bump on Alyssa's leg didn't really go away.
She complained that her leg was sore. So we decided we'll take her in and get it x-rayed. The doctor ordered an x-ray, and then he came to us and said, you know, she's got a fracture in her tibia here. And he said her bones are very unusual.
Her bones are not solid. They're very fibrous. When you see them on an x-ray, it's described as ground glass. They're not nice, solid on the inside. They're very fluffy and fuzzy.
He told us the casing of the bone should be like 4 or 5 millimeters thick. He said, but Alyssa's, he said it's like a sheet of paper. It's very thin. The doctors had never seen this in a little girl before, and they were concerned and didn't really know what was going on.
I was terrified.
Dawn and Russ Hazel's daughter, Alyssa, has been diagnosed with a bizarre condition, precocious puberty. At 3 years old, she's already getting her period. And now, new tests have revealed that her bones are frighteningly thin. Baffled, the emergency room doctor refers the Hazels back to Alyssa's physician, Dr. Mo Jenner.
The parents were concerned with this new information.
We told him we had found out that the casing on the bones were really thin and they're unusual, they're different bones.
And you could almost see a light bulb go off in his head.
Dr. Jenner thinks he knows what's going on, but to confirm his hunch, he reaches out to a fellow specialist.
Dr. Jenner and I were colleagues at Children's Hospital in London, Ontario, in the Division of Pediatric Endocrinology.
Dr. Jenner came back and he said, "Does she have any birthmarks?"
And we kind of looked at each other and thought, well, yeah, she's always had a very faint mark on her right arm.
We're redheads. It's like the color of a freckle, but it's really unusual, but it's not very prominent.
There wasn't much else that it could be, and that was the syndrome that we know of as McCune-Albright syndrome.
McCune-Albright syndrome is an extremely rare genetic disorder. In healthy individuals, genes provide the body with all of the instructions they need to function properly. But in patients like Alyssa, for some unknown reason, a mutated gene triggers early puberty, painful bone deformations, and cafe au lait-colored skin spots.
The gene that's mutated in McCune-Albright syndrome is the GNAS1 gene, but the reason for the mutation is not known. This can have an effect on many systems in the body.
It was a great relief to finally find out that what she had a name.
In fact, the Hazels had seen the very first sign of the syndrome the day Alyssa was born, her birthmark.
The mutated gene can affect skin cells and cause the affected skin cells to appear darker, and this leads to the cafe au lait spots that we see.
Then, over time, the same mutated gene triggered an overproduction of estrogen, stimulating the growth of Alyssa's ovarian cysts, her period, and her growth spurt.
The cysts that Alyssa had in her ovaries related to the high activity of the cells in the ovary that are making estrogen. As these cells work harder and harder, they get larger and larger and form these cysts. These high estrogen levels led to an early growth spurt and early menstruation.
And it also caused Alyssa's bones to develop abnormally, leading to the fracture of her tibia.
Normal bone is going to be composed of harder, more dense bone around the outside, and inside the bone, there's more of a lattice work. It helps with how the bone handles stresses. In patients with McCune-Albright syndrome, this architecture is abnormal. And because of this, the bone becomes more prone to fracture.
And as the disease progresses, differences between the densities of bone can also result in severe impairments.
The worst-case scenario with patients with McCune-Albright syndrome is that the bones can be deformed. You'll see it in the bones of the skull.
When it develops in the skull, it sometimes becomes thicker bone, so we run the risk of having difficulties with her eyesight. Her hearing could be affected. Her teeth could be affected too.
We were shocked with the diagnosis. Now, what does this mean? What do we have to look forward to?
While there's no cure for McCune-Albright syndrome, it can be treated. Alyssa should continue to take the hormone blockers to ward off puberty.
When the blocking agents are removed at the normal time of pubertal onset, which would be around 12 or 13, then she could progress and have the normal hormonal fluctuations.
And Russ and Dawn will have to be careful to keep Alyssa out of situations where her uneven bones can easily fracture.
He said there'll be no contact sports, there'll be no ice skating, no rollerblading, anything that can be risky behavior where you're going to fall down. She's got a little trip and fall, she'll break.
Unfortunately, there's a possibility that Alyssa's bone malformations will eventually affect her appearance.
The facial deformities that occur with McCune-Albright cause asymmetry, in other words, an imbalance of features between the right and the left side, and some overgrowth of bone in the base of the skull and in the cheeks.
I was concerned that Alyssa would be different than other kids.
We didn't want her to experience pain. We don't want your kids to experience any pain.
I was so scared.
Over the past year, Russ and Dawn Hazel have watched their daughter endure a series of bizarre symptoms, from getting her period at age 3 to strange bone fractures. They've finally learned that Alyssa has McCune-Albright syndrome, an incurable genetic condition. Overwhelmed by it all, they can't help but wonder why doctors fail to recognize the disease.
McCune-Albright syndrome is a rare genetic syndrome, less frequent than 1 in 100,000 individuals. Aside from Alyssa, I've seen one other patient with McCune-Albright syndrome.
Now that we know what it is, you can move on and deal with things when they come. She was limited in her physical activities that we would allow her to do. We compromised in other ways, and we protected her as much as we could.
Today, Alyssa is 16 years old. She has experienced puberty like any teenager. And just like any adolescent, she does things that make her parents nervous.
I'm wearing a brace because I was on a roller coaster and I really hurt my neck.
She's a very determined little girl. She's learned to adapt herself to be able to do things that other kids can do. She's well adjusted and she's just happy.
I try to blend in as much as I can at school. It hasn't affected my life that much. I try to act as normal as I can.
While the disease has affected her appearance, Alyssa's case is relatively mild.
Alyssa is experiencing these facial deformities to a somewhat lesser degree than other children with this syndrome.
And the Hazels take heart that her condition hasn't dimmed Alyssa's spirit.
Alyssa is the most positive, upbeat, happy person you're gonna meet. She's always got a smile.
It's an honor to know Alyssa. She's taught me how to deal with things. When I look at her and I see the kind of kid that she's turned out to be, you're so proud. And I hope she gets whatever she wants out of life.
I don't let the disease hold me down. I just try to be positive and just accept it and just go on with life.
While Alyssa Hazel's parents had no idea she'd been living with a terrifying disease since the day she was born, 19-year-old Samantha Mina suddenly developed a debilitating condition that pushed her to the brink of death within just a matter of months. As a young girl growing up in Reston, Virginia, Samantha Mina enjoyed an especially close relationship with her mother, Samia.
Samantha is the best thing that ever happened in my life.
My mom was always super supportive of me. Anything I wanted to do, she definitely believed in me, said go for it.
Their relationship grew even stronger when they found themselves on their own in the fall of 2000.
I was 12 years old when my parents divorced.
It was a very difficult time. She's the one who used to take care of me, encourage me. Samantha was an adult before her time.
Definitely after my parents divorced, my mom and I became best friends and started telling each other everything.
As an Egyptian immigrant, Samia believed firmly in the American dream and always encouraged Samantha to do her best.
Samantha was always an A+ student. A is not good enough.
I do consider myself an overachiever. I've always been very driven, definitely had to be the absolute best at everything I attempted.
In school, Samantha was a dynamo. She consistently brought home top grades and was active in sports, despite her small build.
Samantha was always tiny since she was a little girl.
I definitely have a small frame, bird bones, my mom calls it. I was thin, but I was also healthy. I would do everything all my friends did. I was involved in cheerleading. I got into archery when I was in high school. I really enjoyed running. I was one of those students who tried to do everything.
And when Samantha graduates from high school in the spring of 2006, she can't wait to start her freshman year at the University of Virginia in Charlottesville.
Samantha was very excited to go to college. She wanted to be a professor.
My life was definitely going all according to plan. I took my studies very seriously. I would study every night for hours.
Samantha's very driven, and if it means staying up till 2 a.m. to finish an assignment, she'll do that.
As the end of the spring term approaches, Samantha and Alex celebrate at a local restaurant. She has no idea how radically her life is about to change.
We went to a fancy gourmet pizza place, and I had a big slice of pizza, and I remember about 3 bites in, I felt a stabbing in the upper left quadrant of my belly.
And I thought maybe it was gas. She said, no, it's different.
It was very, very intense.
Within a few hours, the agonizing pain subsides, and Samantha thinks little of it. But over the next 4 days, the debilitating cramps return again and again.
Every time I would eat or drink anything, I would get this stabbing pain. I wanted to scream. The only thing that could make this pain diminish or go away was to not eat. I began to think that something is seriously wrong. So I went to the doctor. I described my symptoms, and I told him I feel like my stomach is being twisted every time I eat, and he said, well, most likely you have irritable bowel syndrome.
Irritable bowel syndrome is a common disorder of the large intestine, characterized by cramping, diarrhea, and abdominal pain. Its cause is unknown.
The doctor said that the only way to handle it is to just simply try to avoid the foods that set you off. And he said all you have to do is figure out which foods cause so much pain and just avoid those foods. And, I thought, that's a possibility. That might be the case. That's when I decided that I would not even attempt fatty foods, junk food, sugar.
I thought if she just ate the right things, then she would be fine and she wouldn't have any more problems.
So I put myself on a very bland diet. I would eat plain bread, crackers, boiled vegetables, boiled chicken. But I found that even the bland foods would cause pain. This sharp, stabbing pain at my upper left belly. It was like a knife, a hot knife, stabbing me over and over in the same spot. It was just so painful.
Then, to make matters worse, just a week after visiting the doctor, a frightening new symptom begins to emerge.
We went on a shopping trip, and she ate some of the food that we had at the mall. She went to the restroom, and when she came back out, she told me that she had thrown up.
I thought that it could be food poisoning or a stomach bug, and it would pass.
But over the next 5 days, Samantha doesn't feel any better, and soon finds that eating more than 3 bites of anything makes her throw up.
I learned to decrease my portions, and so, if I would eat just a handful, I would feel a tiny bit in my throat come back up. And when I did force myself to eat an entire meal, I would projectile vomit.
And along with the vomiting, the stomach pain seemed to be reaching a whole new level of intensity.
I think it was torturing her. She got to a point where she didn't want to eat.
I became afraid of food because food always inevitably equaled pain. I grew to hate meal times. I would have this empty feeling inside of me, this lack of energy, being drained. You need to eat. But I knew if I ate, I would be in pain.
By the end of the semester, Samantha, who normally weighs 100 pounds, is painfully thin.
I was around 87 pounds. This was very alarming, so I called my mom.
It was very worrying, very disturbing. So I stopped at work. I told them, I'm not coming today. I'm going to get my daughter.
2 hours later, Samia walks into her daughter's room and is shocked by what she sees.
When Samantha changed, I saw her arms and her legs. I can see the detail of the bones. She had black under her eyes, and her face got very pointy, and it scared me. I could not believe myself what I have seen and what was going on with her. I knew my daughter was in trouble and there was no time to waste.
Over the past month, 19-year-old Samantha Mina has been unable to eat more than a handful of food without experiencing severe pain and vomiting. Her doctor is confident that irritable bowel syndrome is triggering the symptoms, which can be managed by simply changing her diet. But when Samantha's weight plummets to 87 pounds, she's sure something else is going on and makes an emergency appointment with a specialist.
I saw a gastroenterologist. She gave me an exam, pressed on my stomach in a lot of places. The doctor weighed me and told me that I had what she described as the typical profile of an anorexic, which is young, female, perfectionist. Anorexia nervosa is an eating disorder in which someone deliberately does not eat for the purpose of getting thinner. She told me that I wanted to starve myself. I was just shocked that she would jump to that conclusion immediately when my stomach pains and vomiting were so real, so terrible. I just couldn't believe it. It just made me so mad.
I knew that it was not anorexia. There was something physically wrong with her.
Desperate for an explanation, Samantha sets up appointments with every kind of specialist she can think of.
I went to see a cardiologist. I went to see a rheumatologist. I went to see a hematologist. I must have seen over a dozen doctors and taken as many tests. I was scanned, prodded, poked, x-rayed, just one thing after the other, and they hadn't found anything. Besides telling me that I was underweight, nobody had any answers for me at all, and that was very frightening.
By October, Samantha weighs a shocking 72 pounds, and her health is rapidly deteriorating.
Sometimes I would just get dizzy and tired. Walking back to my room, I would take rests on the curb, put my backpack down, sit down, put my head between my legs sometimes because I'd just be so tired from walking. My illness made me feel just isolated from the world. It was just me and my pain, and nobody would believe that it was there. One November afternoon after class, I wanted to catch the bus to shorten my walk back to my dorm. And the bus started to leave without me. And instinctively, I started to jog after it, hoping the driver would see me so she would pull over. And then I felt like my throat was closing, my chest was tightening. I felt like I couldn't breathe. Next thing I knew, somebody had called for an ambulance. Everything happened so fast, I didn't know what to feel. I was just basically trying not to panic. When the ambulance came, they put me on a stretcher and lifted me into the ambulance. I was taken to the hospital, to the ER, and there they checked my heart rate. I was given an EKG. The doctor said that my heart was weakened by my weight loss. He said the heart is a muscle, and just like you've lost most of the other muscle in your body, you've probably lost some of your heart muscle because you are so underweight. So now your heart has to work very hard, pumping really fast in order to provide enough blood and oxygen. He said that according to the World Health Organization, I was below the starvation point. And that was a very frightening thought. I was hitting rock bottom.
I was very scared for Samantha. It was very scary. I was scared she was gonna die.
It was really frustrating and frightening because nobody knew what was happening to my body. I was reaching the end of my rope, so I was thinking I have to take matters into my own hands.
Samantha throws herself into researching her symptoms, and just 3 days later, she's onto something.
I noticed with all the tests that were being done that they were all focusing on my stomach or my large intestines. So I started thinking, what about everything in between? So I did some research and I read about an upper GI series and how that got good images of the entire stomach, small intestines, and large intestines.
Convinced this may be the key to understanding her condition, Samantha requests an upper gastrointestinal series with radiologist Dr. Ziad Haddad.
I first came into contact with Samantha on January 18th, 2008. Her body was telling her that something was wrong, and she was determined to get to the bottom of it. I was quite surprised with the severity of her symptoms.
That afternoon, Samantha undergoes the test.
So an upper GI series is a study performed by a radiologist where we use continuous x-rays called fluoroscopy. It's a way of looking at the upper digestive tract.
The patient drinks barium, a contrast solution that allows the radiologist to watch in real time as the mixture travels through the digestive tract.
During the test, he said, "I see a problem. The solution is not flowing through your intestines." He said, "This is extremely serious." I was very frightened, but I was determined to find out what was wrong.
Over the past 8 months, Samantha Mina has been losing weight at an extremely dangerous pace. Eating more than 3 bites of food makes her projectile vomit, and no doctor can tell her why. But now, Dr. Ziad Haddad has uncovered a lead during an upper gastrointestinal exam.
The contrast could not really progress past the third portion of her duodenum.
The duodenum is the first section of the small intestine, where most digestion takes place.
After the completion of the upper GI series, in conjunction with her history, the diagnosis was pretty clear. I was confident that the diagnosis was superior mesenteric artery syndrome.
Superior mesenteric artery syndrome is a rare condition involving the digestive system and arteries. In healthy individuals, the duodenum, located at the top of the small intestine, runs between 2 branches of the superior mesenteric artery, or SMA. But in patients like Samantha, the duodenum becomes pinched between the 2 blood vessels, making it impossible to digest food.
In healthy individuals, as the duodenum passes underneath the SMA, the angle is wide enough for the flow of food. As that angle becomes more and more narrow, it starts to compress the duodenum. So think of the angle as an upside-down V, or almost like a nutcracker. As the angle becomes more and more acute, it compresses the duodenum more and more.
I definitely couldn't believe it. There's an artery cutting across my small intestines, preventing me from eating. I wanted to shout from the rooftops, like, "We found what's wrong with me. I don't have an eating disorder. I'm not anorexic."
However, Dr. Haddad suspects Samantha's small frame probably set the stage for the disorder.
I'm not sure what the tipping point for Samantha was, but that weight loss then exacerbated what was already probably a narrow angle for her SMA. Once that angle narrowed beyond a certain threshold, then the obstruction began, and then her downward spiral began. Your digestive tract is just like any other plumbing. When there's an obstruction, things back up. Vomiting is almost like a protective mechanism to decompress those structures. So she was vomiting, she wasn't getting enough nutrition, and thus she's had weight loss. Had Samantha never been diagnosed and never been treated, she would have continued to lose weight, and that would have been a life-threatening condition.
After I was diagnosed, I was extremely relieved. I was just thrilled, and so was my mom. Everything fell into place. I wanted to know what to do.
The treatment is a surgical procedure where you're basically reconfiguring the bowel, the small intestine, in order to divert the flow around the obstruction, such that food is not going underneath the SMA anymore, it's going around it.
But the surgery is risky. Samantha is so underweight, heart failure is a real possibility.
My worst fear when Samantha was going to surgery is that she is very, very thin, and it might be too much for her to handle. So it was scary to know that she might not come out of it.
And there are other serious complications that Samia and Samantha must face.
The surgeon explained to me that there is a possibility that the superior mesenteric artery would be severed, and that would cause hemorrhaging. This is a major artery that branches right out of the aorta, which stems straight from the heart. So to hear that from just nicking that artery, I would bleed to death, was terrifying. I remember just crying, saying, "Is there any other way? Is there anything else that can be done besides surgery?" He said, "I'm sorry, no. If you do not have the surgery, you will die." I decided that despite all the risks involved with a surgery like this, that I would go through with it. My surgery was scheduled for 3:30 p.m. on January 31st, 2008. I just felt like, let's do this. I'm ready to have my life back.
Finally, Samantha is wheeled into surgery.
It was a long wait. I've been through a lot in my life, but that was the worst experience I ever had.
After 8 long hours, the operation is complete.
I remember waking up in the anesthesia recovery room, and I saw the surgeon there, and he said, everything went according to plan, everything is fine. I felt relieved. I was told I had to take at least 1 semester off, but I needed a year to recover from SMA syndrome as a whole. I was put into physical therapy because I had lost a lot of my muscle mass from all the weight loss and the malnutrition.
She still had to be on some liquid diet and then soft diet, and then little by little introducing the solid food. So it was like a mother who is feeding a baby. Every day was an improvement for Samantha, and that was exciting.
I remember standing on the scale at a post-op appointment and seeing that scale read 85, and that was the most beautiful number to my eyes. I was just thrilled, and so was my mom.
As Samantha begins to recover, she can't help but wonder why not one of the many experts she consulted was able to recognize her condition.
SMA syndrome is a rare disease. The diagnosis of SMA syndrome is hard to make on a clinical basis alone because the symptoms associated with it are fairly nonspecific.
I was just so happy to be on the road to recovery.
Today, Samantha feels better than ever. She graduated from college with honors, and her future looks bright.
I feel like I do have my life back. I do anything I want to, social events. I have more energy.
Samantha gained 30 pounds since she got sick. She's a blessing. She's a joy. She's happiness.
I would say Samantha is a better person. She was already a great person, but I think her suffering, it's helped her realize what's most important to her in life.
I will soon be starting law school at the University of Virginia. I'm specifically interested in patient advocacy. Sometimes in the healthcare system, you have to be your own advocate. Don't ever let someone brush you aside, say that nothing is wrong and there's nothing we can do about it. There always is something you can do. I am living proof that there is hope for people with my condition.